Let's talk about back problems, because I know a lot of people are suffering from back problems right now. They're at home. We're in COVID quarantine, and a lot of us are working at these makeshift workstations with, computers on trash cans or on Amazon boxes. And Colin Haines, you are a spine surgeon at Virginia Spine Institute, and I know that you are getting more phone calls from people who are suffering from back problems at home, and wanted to talk to you about some of the issues that are causing these problems. And it's not just homemade workstations, but it's increased stress. Let's talk about first the stress issues. Why is stress causing more problems with back pains? How does that work?
Sure. Laura, the world certainly has been turned upside down by COVID. And if we're lucky enough to still be employed, there's a lot of stress of having kids at home that are screaming, trying to educate them, the fear of getting outside your house and picking up COVID, the stress of the workplace. And then, of course, if we're unfortunate and we're furloughed or are not currently working, it's an extremely stressful time. Well, stress impairs the body's ability to heal. So when we're stressed, our bodies are angry, they're inflamed, and the normal injuries, the small injuries that we accumulate on a day-to-day basis, we can't heal them as well when everything's going haywire in our body.
Yeah. And I know 65% of Americans say they've already are dealing with back pain. And so this is a real issue as it is. What kinds of calls are you getting into your office right now from people? Are you seeing an uptick in back pain from people being stressed out at home or having these makeshift workstations that really aren't ergonomically safe for their back?
We really are. Everyone's pressing pause on their normal life at this point. And that's meaning that people aren't working out as much. They're more stressed. Their bodies aren't healing as well. They're not sleeping. But also, just as you touched on, their ergonomics aren't the same. Workplaces, especially in such an expensive place to live like Washington, D.C., oftentimes aren't ideal. Sometimes people are sitting on their toilets and doing their work. Sometimes it's using their dishwasher or laundry machine as a workstation itself. And that places a body at a bad spinal posture, and that risks potential disc injuries. So when we're hearing about people calling in with new onset pain, that's one of the common themes we're seeing. It's not people who are getting tackled in a football game or in a car accident. It's just normal day-to-day injuries that accumulate and are causing a lot of pain.
Mm-hmm. And then the other issue is the break in the daily activities. I mean, normally we're going to our physical therapy, or we're having regular massages, or massages maybe once every quarter if we're lucky for that. But so that's kind of messing us up too. Maybe we're not getting yoga as we normally go. So how does that break in activity affect us too?
Gyms are closed down, yoga, Pilates studios are closed down, but even more so, people aren't getting up, walking to work, walking to the metro, or even walking to their car. A lot of times people are walking, they're rolling out of their bed, putting on their PJs, going straight to work downstairs. So the fact that we're not able to work out, to pump our muscles, and that people aren't getting the early stretching that's so often associated with just normal day-to-day activity, that's resulting in a lot of injuries.
So that really affects mobility too, and joint stiffness and all of that.
When the muscles don't loosen up and the muscles don't get the proper blood flow, they tighten up. And tight muscles are one of the major causes of back pain or neck pain.
And I would imagine right now more people are using the time that they have to do more home projects. So we know that can lead to potential for injury if they're lifting boxes or doing something that they can't do. What are you seeing? Are you getting any calls about that?
Well, personally, yesterday I was cleaning up mulch with my wife from the rainstorm. And after my wife, she wasn't raking using the proper form and her back was really hurting her. People are doing home projects, and that's resulting in a lot more injury because we're forgetting to use the proper form because of everything that's going on. Our minds are distracted, and someone's back oftentimes takes a lower priority with what's going on in the world right now.
All right, so let's talk about what you can do at home to kind of solve these problems. First of all, what can we do for those workstations that are homemade but maybe aren't so ergonomically safe? How can we make them better and more ergonomic for us?
So we want to think about both the neck and the low back. And the reason for that is that if we do hunching forward at our neck, what we lovingly call tech neck, where we're using our cell phones, reading books, and bending forward, that puts a lot of force on the discs in the neck themselves. It also can irritate the individual nerves of the necks, causing radiating arm pain. What we can do to correct that is maintain a good neck posture. What I mean by that is when you stand up, think about how your next position, that's what we want to simulate when we're sitting down. So elevate that desk. If you're fortunate enough to have an elevated desk, raise it up relatively to eye level so you're looking straight out. If you don't have an elevated desk, get some books. That way you can lift your computer monitor or even your laptop itself.
Okay.
For the low back, sitting, it puts a lot of force on the discs as well. Ideally, I'd love you to have an ergonomic chair, something that has a nice lumbar support to maintain that low back curvature as well. However, if you don't have an ergonomic chair, simple fix, put a thin pillow or a rolled up towel under the small of your back to accentuate your curvature.
Okay. And would you say that's an investment really in the strength of the back or in your posture? I mean, how important is it to have an ergonomic chair?
I think it's very important. And now you don't have to purchase an ergonomic chair, but to maintain the body's posture through either an ergonomic chair or using a rolled up towel to stimulate the normal curvature of your spine is really important. The key thing here is prevention first. If we can prevent back injuries, then you never have to make those phone calls into the Virginia Spine Institute or another spinal institute.
Okay, so I don't need to go spend a whole lot of money. It's just doing those simple little things: the rolled up towel or the small pillow. And you say also 2 feet on the floor is the best way to do it. Don't cross my legs when I'm sitting. It's the 2 feet on the floor, flat on the floor.
Yes, you want to keep your feet ideally roughly at shoulder width. If you're crossing your legs, that can actually stretch the nerves, causing radiating tingling down the leg. The other thing it can do, can irritate the disc or the SI joints, the sacroiliac joints. When you're putting too much abnormal stress on them, it can result in a lot of pain.
Okay, and then what about you say putting your book, your laptop on books, but then my wrists are like that. So how does that work?
So if you're using if you have a desktop, you can elevate the monitor specifically. If you're using a laptop, the way to avoid that is you can put books more towards the back of that laptop. That way it elevates up the screen preferentially. In addition, if you increase the angle of that monitor, you can result in elevating the monitor visualization part itself specifically while maintaining that keyboard at a relatively normal position.
Okay. And then one other great tip I thought you had, because I constantly get into this position and I need to be thoughtful about this. How do you remind yourself to sit back up straight, get back into that better position?
I'll tell you, even as someone who thinks about their spine all day long, I find myself, if I'm engrossed in my work, I hunch forward as well. So what I do, I set a timer. Every 30 minutes, have that timer ding. That's your reminder saying, okay, time to get up and stretch, time to loosen up those neck muscles, time to reevaluate your posture. Because again, it's all about prevention. We want you to be able to avoid ever having back pain or neck pain.
You really have to be mindful of how we're sitting and how we're working these days, especially in this very strange new normal for now. All right, Dr. Colin Haines, thank you so much. Spinal surgeon at Virginia Spine Institute. Appreciate your input.
Thank you very much.